Exchange. Right. I'm gonna call the meeting to order. It's 2:04. And now that we have quorum, I'm gonna ask for the first action for the approval of minutes.
So
And those are the May 20th meeting. I'm sorry. And I didn't specify which meeting minutes.
second,
And just a point of order, if all board members could put their cameras on so that we can see when we do voting.
Yes, that would be helpful.
So that's Aika and Joy
And sing if he's
and
voting.
Sing, yes.
Right, so, or Cynthia, how will you capture votes?
Looking now. Looks like I need two people have their, I have the,
Okay,
We need Sing if Sing's on.
so we have a second. All in favor? Aye.
It's not Aika and Joy.
Any questions? Any opposed? So did Singh vote or he didn't vote?
Sing, are you on? Can you acknowledge if you're online here? You're on mute if you're talking.
I can't see him.
Who?
I don't see his name, Michelle.
No, I don't either. Other 410-736. Who's 410-736? 0871. Okay,
Okay, then, but we have enough votes.
we do.
Okay,
have enough.
so, meeting minutes passed as presented. Thank you. So no public comment period, no one signed up, so, we'll move on to the executive director update given by Michelle.
Thank you. And before we start that, I think we could do the meeting dates for 2025. Let me first start by thanking everyone for being here at our annual meeting. This is our designated annual meeting, and you'll recall in the board bylaws, it designates every June to be the annual meeting, but we moved it to July for this year. So thank you. It's our annual meeting. And each annual meeting, we do approve the following year board meeting schedule. So Cynthia, if you can pull that up for us, we can look at that. And for Chair Herrera Scott, I will turn it over to you to confirm the dates. And one thing we'll have to do again is move that annual meeting to July.
Correct. So these are the proposed meeting dates for the next year. When we first, or at least when I first started in this journey as the board, we were in person, and then we had at our annual meeting made the decision about a hybrid schedule for virtual and in person. The problem with the hybrid schedule is that even when we deem a meeting to be in person, it's still hybrid. And I do think there's benefit from people in the room contributing to the discussion versus being online. So one, we have to look at the dates, but two, could we collectively agree for at least two of the meetings to be in-person meetings, if not more, recognizing that almost all our meetings, at least this year, have been hybrid. So feedback on what I'm saying, proposing for, well, first, looking at the meeting schedule, does that work for everyone? But then, you know, my recommendation to mandate at least two for in-person, and then go from there. Thoughts on in-person meetings? Fine with me. Fine with you, Dana? And
I'm fine with the two mandated, and I also flagged to May 19th is my birthday, and I know that I won't be here, so I just wanted to flag that for the group.
happy birthday. But if you came, we could have cake.
Still have cake.
Yes, we could. We could celebrate Aika's birthday in her absence.
And typically what we've been doing is trying to use the annual meeting as the retreat day as well. This year, because we're short of board members, permanent board members, we decided to postpone it to September.
Okay. So who else is on?
We have
Joy.
Aika.
Aika's fine with two. She just acknowledged that May 19th she won't be here. And then Joy, any opinion? You're a voting member of the board.
No opinion either way.
April and July.
Does April and July work for people for mandatory meetings and then we can make the other meetings hybrid? No, that's just.
So then there will be a motion to approve these dates, making July 21st the annual meeting
Okay,
and the April 21st and July 21st meetings in person.
so make a motion now. So I'm gonna make a motion for approval of these dates, acknowledging that the July 21st meeting will be the annual meeting and that the April 21st and the July 21st meeting will be in-person meetings.
Second.
Second. All in favor? Aye.
And raise your hand if you're online. Yes,
Aye.
perfect.
Any question? And no, Sing's not on.
Yeah, that number, I just got an email, it's Rochelle Briscoe, that she couldn't get her mute off fast enough, so that's not. saying.
Okay, okay. So motion carries.
Now I'll move into my update. Thank you very much for that business. Just a couple things on the federal policy issues. I was just at the State Marketplace Network convening in Minnesota last week. We had an excellent convening with, this was the first year in many years that we actually brought staff with us. We had functional areas be able to work together and talk and had really good presentations. But all the focus right now in our circles and in companion circles and at CMS is really on the expanded tax credits that today are set to expire at the end of 2025. And just really reaching out to all legislators to, again, have everyone recognize the importance of that and the impact that if those expanded tax credits go away, likely we'll lose enrollments. And of course, we don't talk about this often, but Medicaid has reference pricing for their medical claims. Medicare has it, but in the individual market, we don't have it. And so we really are impacted by the cost of medical care. And as an exchange, we have certain levers we can use, such as reinsurance, which Maryland, we've done exceptionally well with that and some of our subsidies. But there's only so much we can do. And these tax credits really help make health coverage affordable for many people, which we've seen nationally in the high growth of folks getting health coverage. So everyone needs to be getting that message out now because we're going to have, not much of a runway once next year comes, and the timing of when rates get filed, but even more important than that, when people have to file for health coverage, which is November. So that will be a challenge. Also,
And does the tax credit end on the federal fiscal year?
it would end the end of December 2025.
The whole year, calendar year. Okay, okay.
That's how the law was written.
Okay.
Also, and Secretary, you know this quite well, but for everyone else, on July 2nd, CMS announced that Maryland, Vermont, Connecticut were selected as the first states to participate in the states advancing all payer health equity approaches and development, the AHEAD model. And for those of you who don't know, under AHEAD, CMS will collaborate with states to curb healthcare cost growth, improve population health, and advance health equity by reducing disparities in health outcomes. And again, that will really help drive the premium costs and the inequities that we see and the things that we do as an exchange to try and keep costs low and make sure that our product offerings really address all the needs of all Marylanders. Let's see, the other thing that came up from CMS is that CMS is very much interested in continuing the account transfers, Medicaid to Marketplace, back to Medicaid, that whole continuum. Again, referencing the 3 M's, Medicaid, Marketplace, Medicare, and making sure in that continuum of healthcare coverage that there's seamless journeys. So that was something that we're ahead of here in Maryland. On the state updates, we welcome Joy Hatchett here today, who is the acting commissioner of the Maryland Insurance Administration, effective July 2nd. So welcome, Joy, to your first board meeting in the capacity as acting insurance commissioner. Joy has actually been with the MIA since 1993, holding various roles. And so we're lucky to have, as a state, to have her level of expertise that she can move into this position. Our June enrollment report is out online, and the dashboards are updated as well for state legislative districts. But again, what's really great is that our enrollment is up 22% year over year from this time last year. Typically, what we see as the year goes on is those enrollments start to decline. With the ending of the public health emergency unwind, we saw those continuing. We're now starting to see them level off. So our enrollments for June year over year were down, but the overall enrollments are up. So we think that that's probably makes sense that has started to balance out. And likewise, in our income-based Medicaid enrollments, we saw the ones we have on the exchange were down 3% year over year. So that again makes sense as we're seeing them move into other coverage. In terms of updates for staffing, we have hired a new HR manager, Terry Maury, who comes with us with 10 years of experience and came from Johns Hopkins University Curie Business School, where she was managing projects and leading recruitment and employment engagement initiatives. Janae Knox, our constituent services coordinator, started, and she's been with Maryland as a state employee over 8 years, coming to us from the MIA, and before that, the Board of Certification of Residential Childcare. And most exciting for the exchange, because we've been working on this for years, we have 7 new state PINs that we're onboarding by the end of this month, all in IT, and 6 new contractual employees that started in our consumer assistance division as of July 1st. So huge shout out to our business teams and particularly HR. We haven't onboarded contractual since I think year 1 of the exchange. So that was a big lift, but getting everyone onboarded, and we're thrilled to finally have these staff. So I will stop there, and if anyone has any questions, I'd be happy to address them.
Any questions for Michelle?
So I don't know if our attorney needs to answer this question, but a week or so ago, there was a post story about Maximus, the federal litigation. And I just wanted to circle back, given what we had gone through, that there's no ramifications on us. They seem to be independent, but perhaps worrisome, but nothing directly affecting the exchange operations.
I don't believe so, but Sharon,
Yeah, so from what I know, no ramifications.
you want to come up so closer to the mic?
Thanks. So I don't, from what I know about it, there are no ramifications. We have not been in touch with CMS, but that doesn't, it doesn't concern the contract that we now have with Maximus. But we'll certainly keep an eye on it, but I don't think it impacts our contract with Maximus, but you know, certainly something we should look at.
Any other questions for Michelle? Thank you, Michelle. Next, we'll move on to Amelia Marcus to give the update on the proposed small business regulations.
Amelia's
you.
joining us.
Can you hear me okay?
Yes.
Great, thank you. Yeah, sorry I couldn't join in person today, and also apologies in advance. My dog has been very barky, so if she interrupts, I apologize. My name's Amelia. I'm a health policy analyst on the policy team, and I'm just going to give a quick overview. MHBE is proposing 2 relatively straightforward regulatory updates to our MHC for small business or shop functions. Regarding 1, changes to our minimum participation rate, and then waiting period requirements for employers who offer coverage through MHC for small business. So as a reminder, or for anyone that's not familiar, just quick definitions. Minimum participation rate is the % of eligible employees that must enroll in a group plan in order for a small employer to then be eligible to enroll in coverage through MHC for small business or SHOP. And then waiting period is defined as the period of time that must pass before coverage for a qualified employee can become effective under that small group health plan. So the first proposed update to minimum participation rate is to reduce the NPR for SHOP eligibility to 60% uniformly. The current regulations vary slightly depending on whether a group offers plans under the employee choice or the employer choice model, but is generally currently set at 75%. So reducing the NPR from 75 to 60%. And then the second proposed update is to reduce the maximum waiting period that an employer may set for its employee from the current 90 days that's set in regulations now to no more than 60 days, with coverage to then become effective the first of the month after the end of that wait period end date. So 60 days plus any additional time for the first of the month to hit. Next slide, please. So just for a little additional background, these proposed updates both were initially brought to MHBE's attention by our Small Business Stakeholder Standing Advisory Committee, or SBPAC. So specifically regarding the minimum participation rate, SBPAC had provided feedback that the current 75% NPR is often very difficult for some small employers to meet. And then federal regulations allow state marketplaces the flexibility to modify their NPR. So for example, BC has already established a lower 66% NPR for their SHOP, small business functions. And then for waiting periods, federal regulations limit the waiting period to a maximum of 90 calendar days for coverage to become effective for a qualified employer. However, MHBE's state regulations currently allow for a maximum 90 days as well, plus any additional time for coverage to effectuate at the first of the following month after the end of the waiting period. So that could end up amounting to up to 120 days in total instead of 90 days. Hence the proposal to reduce our state regulations to a maximum 60 days waiting period. Next slide, please. So just a quick overview of the timeline. MHBE has already shared these proposed regulations with our Standing Advisory Committee and the Small Business Programs Advisory Committee for informal feedback per our usual process. And then we opened a 30-day informal stakeholder comment period, which closed on May 12th. We received feedback from 2 insurers on these proposals, and both of them commented expressing that they're comfortable with the proposed updates to both NPR and the waiting period regulations. So if the proposed actions are approved today, we would expect regulations to be ready for a board vote on the final action at the October board meeting, with the regulations to become effective by November 11th of this year. So that's it for those 2 updates. I'm happy to take questions if there are any.
So Amelia, I have a question. How is the 60% decided? Like, how do we get to that number? Like 75 is too hard, but how do we get to 60 as being the threshold that the small businesses would be comfortable with?
Yeah, good question. So we surveyed all the on-exchange carriers, and all of them either already have a uniform 60% minimum participation rate or were comfortable moving to 60%. So that's how we got to 60, that's already in practice for most of the on-exchange carriers.
Any other questions? So I move to approve the proposed small business regulations as presented and authorize MHBE to submit them to the Joint Committee on Administrative, Executive, and Legislative Review for review, and to the Division of State Documents for publication in the Maryland Register as presented.
Second.
Thank you. All in favor?
Aye.
Aye.
Any questions?
So, yeah, I'm in favor of this, but one thing I think it would be helpful for the board moving forward to know what the impact is, and to come back a year, perhaps 2 years after implementation to see if it really moves the needle. I mean, there is some concern I have that 60% allows some gaming for, you know, high wage individuals, but I think it's the better fraction we have to choose one to go lower rather than keep it at 75. And it looks like the market has already moved in that direction, but the idea was to try to make products attractive to as many people as possible. It's not always a simple answer.
You'd like that follow after years experience?
Yeah, I think that reporting back, did it make a difference? And the carrier should be able to give you some guidance on that.
Does that need to be a formal motion or it could just be a recommendation for the board?
It can be a recommendation from the board.
Okay. Motion carries. Next, we're gonna hear from Becca Lane on a few topics. Starting with, the 2025 reinsurance parameters.
Good afternoon, everyone. I'm Becca Lane. I'm the Senior Health Policy Analyst on the Policy and Plan Management team. And I have the privilege of speaking to you on 4 different items today. The first is on the final reinsurance program parameters for 2025. So first slide, as you know, as per regulations, the board each year sets the final or sets the payment parameters for the state reinsurance program. And the parameters include an attachment point, coinsurance rate, reinsurance cap, and then the board also determines whether a dampening factor is necessary, and if so, the commissioner provides that factor. The next slide.
Yeah, I think that's, oh, never mind, that's how it works, so he's gonna let her in, thank you, sorry. Is that the door?
So to refresh you on the impact of the reinsurance program so far, we've seen an impact in terms of premiums as well as an enrollment. Premiums have been reduced by, at this point, still a total of 20% since before the program was implemented. The full impact of the premium reduction was realized in 2021 when the reduction was over 30%. But since then, we've seen small increases in rates since then, which is expected. But like I said, rates are still much lower than they were before the program. In terms of enrollment, on exchange enrollment has increased by about 36% since 2019, the start of the program. And total enrollment, so on and off exchange, has also increased. Off exchange is not pictured, but the total enrollment is up about 33%. We can't say that all of this enrollment growth is due to the reinsurance program, because we've also had the enhanced premium tax credits through the American Rescue Plan and Inflation Reduction Act, and also the Medicaid unwinding, but we overall have seen enrollment improve. Next slide, please. So as you may recall, in February, this board set estimated parameters for 2025, including an attachment point of $21,000. And in general, each year we've been holding the other program parameters constant, with the exception of the attachment point and the dampening factor. So our 2023 data is in, and our actuaries have done their analysis, and it is still looking appropriate to keep the attachment point for 2025 at $21,000. And the MHBE staff recommendation is for the 2025 final parameters to be an attachment point of $21,000, coinsurance rate of 80%, cap of $250,000, and a dampening factor to be determined by the commissioner.
He has a question he raises.
Go ahead, Singh.
Thank you. When we said in the previous slide that the premiums are lower than when the program was started, on that spreadsheet or sheet, we see only percentages, increase or decrease. What's that in absolute dollars? What was the premium for any one category, when the program at inception, and what are those premiums now?
Thanks for that question. That's not something I have off the top of my head, but I'm happy to go back and find some more absolute numbers for you and report back.
Thank you.
All right.
And I will just add that we are still nationally, we still have the lowest bronze and the lowest gold plans in the nation. So if you look at our average monthly premium compared to that, say, of Alabama, you'll see significant lowering, but we can certainly say, yeah, I think we've got that somewhere. We can pull it up what it was year over year, that average premium rate.
Absolutely.
Circle back to the board on that.
Next slide, please.
Wait, and just so I'm clear, the commissioner is the insurance.
The insurance.
Okay,
commission.
I just want to make sure.
Back one slide, please.
What else? That's it. Is that it?
The cost and cost and funding projections, great, thank you. So this slide gives us a graph of the reinsurance costs and funding projections through 2028, which is the end of the waiver period currently. So as you can see here, in the first 3 years of the program, we received significant federal funding, and we were able to cover the cost of the program entirely with federal funding and save our state funding in a reserve fund, which came in handy in 2022, which was the first year of the program in which costs exceeded the revenues that we made in that year. We were able to dip into our reserves to help pay for 2022 program costs. In 2023, you'll see again, the funding bar is again higher than the cost there on the slide. Things are looking better, but overall, in our most recent round of projections, we see a fund balance at the end of 2028 that's about $288.5 million. And then just the assumptions that go into these projections include that $21,000 attachment point for 2025 and an increase of $1,000 each year thereafter. Each year thereafter. So I think that's,
So,
yeah.
so does the lines and the changes in the lines, are they reflected by the change in the attachment points year over year after 26?
Yes, it takes that into account. Mhm.
Before you move on to the motion, I just want to add one thing that's going to be really important for the board and for us to communicate to the legislature, because in the past, it looks like there is a lot of money in this reinsurance fund. And in the past, it's been used for other areas. One thing that is really important to note is that if the expanded tax credits go away, and we, as a state, decide we're going to supplement what has gone away, that will really deplete this quite quickly.
But I'm assuming if the tax credits go away, we're gonna be revisiting this and what is the wouldn't we be looking at the attachment points and everything else again, or no, that's decided for X number of years?
Well, these projections take into account that the enhanced tax credits will expire at the end of
They do.
2025.
Okay.
If the tax credits are extended, we'll be in, of course, an even better funding position at the end of 2028.
So is that in the slide deck and I missed it, as far as the assumptions that this picture is taking into account?
It should be in that first bullet point on this slide. It says the projections assume attachment point increases and then enhance. It's a little buried there. Yeah, there you go. Dina.
Sorry if I missed it and you said this, but we went from $20,000 to $21,000. How did you come up with the 21,000? Because, I just want to.
Sure. So
You're thinking.
yeah, so based on our available funding, our actuaries did some projections and were able to determine that increasing the attachment point is going to help us stay within our means.
The other factor in that is that because the costs of care of medical claims are going up. So again, if by not increasing somewhat proportionally, we're paying more of that cost.
I assumed that, but I want to assume.
Any other questions for Becca on this? I have that decision to make.
I think we have a timeline slide as well, but we're probably good to go on to the motion.
I move to approve the 2025 reinsurance parameters as presented. Make it a second.
I'll second this.
Second. All in favor?
Aye.
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 Right, okay. Arm, so no need for questions or opposition.
Right.
Okay, motion carries. So next we'll go on to the 2025 young adult subsidy parameters.
That's right. You can keep advancing. Great, thank you. Oh, yep. Perfect. So this second item I'm bringing today is the 2025 final young adult subsidy program parameters. On this first slide, I'm just gonna go over program performance so far. So in 2024, we've seen an increase in enrollment through the young adult subsidy program. We currently have about 67,000 young adults enrolled through the program. That includes almost 45,000 auto-renewed enrollees who are already enrolled, and new enrollment of about 22,000 individuals. So the average subsidy through the program is about $38. And if we are factoring in current enrollment, the cost for the year is projected to be almost $24 million. If we include the projected special enrollment period enrollment, we project that the total cost for 2024 will be almost $25 million. And as a percentage of total enrollment, young adult enrollment has been increasing, increased from 26.4% in March of last year to almost 30% in March of this year. So the program is doing well. On the next slide. This is an overview of this year's program parameters, 2024. So right now, the program covers young adults between the ages of 18 and 37. So over age 18 and then through the 37 year, and then at 38, the people at 38 are no longer eligible for the program. The individuals to be eligible must also have incomes of up to 400, up to and including 400% of the federal poverty line, and they cannot be eligible for Medicaid. They must be enrolled through Maryland Health Connection, and then we have a cap on enrollment in case our projections indicate that we may exceed the budget. So the way the subsidy works, as you may already know, it reduces the maximum expected contribution for individuals who are eligible. The maximum subsidy is available up to the age of 33, and then in 33 or after the age of 33, the expected contribution reduction reduces slightly. And then the subsidy also includes the cost of the non-EHB portion of premiums for people who would otherwise have a 0% expected contribution. So these are this year's parameters. Next slide, please. For 2025, the staff recommendation is to revert, the proposed parameters that the board voted on I think in the April meeting, or some previous meeting, is to revert to the 2023 program parameters. And again, this is to ensure that we stay within our budget. So the 2023 parameters just included an age range of through age 34, phasing program out through age 34. And so instead of age 37 from this year, it would be going back down to 34. We estimate that this would cost $21.5 million, and that enrollment would be about 46,000 individuals. We do estimate a loss of about 380 individuals as a result of changing the parameters back down. But here you can just see on the slide the kind of graph of the program parameters for 2023 that we are proposing to finalize for 2025. Yes.
So back up. You mentioned at the start that this year the program has 65,000 enrollees. And next year, or 2025, we're projecting 46. That doesn't seem like 383 people off. What happened to the other roughly 20,000 people?
I believe that's so through the change, that loss would be from the individuals 35 to 37. And then with the changing parameters, we estimate that an additional 380 would also would drop because of the lower available subsidy.
So I'm sorry, go ahead.
Yeah, go ahead.
I'm just building off of what you said.
I'm still kind of confused about the 20,000. You know, if we say 40, 60, 65,000 now, 2025, 45,000.
I
How
think,
does that, where did those 20,000 people go?
yeah, I think, again, to best of my ability to respond to that is, it would be just due to the change in the reduction in the age eligibility.
Did those numbers come from Lewis and Ellis,
Yes.
their estimates? And was that estimate not related to the reduction, but just the overall marketplace?
I think so. So, individuals who are maybe more price sensitive would be, that's where the 380 are coming in.
I think it would be helpful as we think about these subsidies is giving the ages of the people in the individual market in this subsidy. So even if you said, you know, all your less than 30, you know, where you have cutoffs, because then to Ben's point, you can see the people movements that are going to happen for the next year based on the decisions that we're making now. And then, you know, decisions might be different depending on how many people impacted. And I understand that we're backing into a number, but without having a little more information about the people impacted by those decisions, it's confusing. So I hear what you're saying as far as the assumption is that there are people that are the 20,000+ are people aging out.
I just had a thought. So you have estimated subsidy eligible enrollment. Was the 60,000 subsidy eligible or the entire age bracket group?
I would have to check on that.
We'll have,
Yeah, it's worth a
get it.
follow-up
Yeah,
just
we'll
for,
have to get
it's hard to understand Yeah. the moves, the
Yeah.
people moves in and out of the subsidies of the different programs without having the breakdown by age.
right.
So,
And I'm sorry.
yeah, just to the secretary's point, I mean, actually, I think if you took this would be really helpful, I think, if we could see the count of people
Yes, I
in
agree.
this matrix as opposed to, you know, the percentages offset. I think that would give us a better understanding of what we're actually looking at.
Or even if you had two tables, one, so you could see the movement in the expected contribution, but then you'd know how many people were impacted by that change in the contribution.
Yeah, and another question, do the people, when they signed up and then they age out with the new parameters, were they expecting not to age out? Like, did they know what the maximum age is and are they maybe expecting it to still be available? Do you know, or am I?
It'll be unfortunate to have to kind of take away something that we've provided, but I don't think we would have had a way to kind of tell them in advance whether or not they would receive another year of the subsidy.
Okay,
Yeah.
okay, so they may not know that they would have maybe had
Right.
another year, okay.
And it's still a pilot program anyway, so it all goes away at the end of 2025 unless there's legislative action.
Right, that's helpful to know.
So this is key information and what does this do to your timeline if we were to hold this motion to the next meeting to get that information so we can all understand what's happening to the 20,000+ people that are being impacted by this shift?
I think I have a timeline on the next slide. Or maybe oh, maybe not. Let's see. Timeline wise, the next meeting is in September.
No, we're gonna do in August, a
Oh.
very short meeting in August.
Okay. I think that would probably be fine.
That way we can get more information back to the board.
So do I need to make a motion to hold this, or is everyone good with holding this decision till August so we can get that information and then just be a little more informed on the decision?
We can pend it to August.
Any concerns from those of you on the phone?
No,
And also the number that was quoted as far as per person, I thought was 300 something, and if you just do the simple math here, it's 465. But there's no tying of this information together.
Sure, go
Look
back.
at 21.5 million divided by the 46,000 is 400, and maybe I'm not doing that right, but $465. And I thought another number was quoted previously.
Oh, the average, per member per month subsidy is per month number. So if you're dividing the annual cost by the number of enrollees, that'll be a per year, I think. So that's why. So you'd have to divide it by 12 again to get the average.
Right.
Okay, so we're gonna hold this motion for August. So next we'll move on to the re-enrollment regulations.
Okay, great, thank you. So as a refresher on the re-enrollment regulations issue, right now, MHBE's regulations don't currently address the re-enrollment process. It's something we already do, it's just not codified. And then in 2024, federal regulations authorize the federal exchange states to crosswalk individuals who are in bronze plans to be moved to silver cost sharing reduction plans during the annual re-enrollment process. And that's under certain conditions. So when the silver premium is equivalent or lower than the bronze plan they were previously enrolled in, when the silver plan is within the same product, and when the silver plan has the same provider network as the original bronze plan. And this was an optional change for state-based marketplaces. On the next slide. I think back one. Yep, thank you. So to review, in April, the board approved proposed regulations. So the proposed regulations included codifying the existing process for re-enrollment, and then also codified a requirement that carriers who are planning to discontinue plans submit re-enrollment templates. And that's, again, something they already do, but as we were proposing this, we included that as well. And then also establish a process for crosswalking the CSR eligible bronze enrollees into the higher value plans. And so what Maryland is considering is slightly different from the federal process, and those differences are just highlighted yellow. So as I mentioned, the higher value plan must be in the same product, have the same provider network, and have a premium that's the same or lower as the original plan. And then the highest plan available in may be actually a gold plan in Maryland, not just a silver CSR. So we've built that into the proposed regulations as well. So that's why higher value is also highlighted, because otherwise we would just say silver CSR, but we're doing higher value. We, based on stakeholder feedback, did not include HSA compatible plans in the eligible group for this process. So if someone's enrolled in a HSA compatible bronze plan, we decided that there's a chance that they chose that plan because it's HSA eligible or HSA compatible. And so it might actually be worse to move them, keeping them there. And then we estimate that about 4,300 individuals could be moved into a higher value plan if we adopt these regulations. Next slide, please.
Becca, do you want to just speak to when someone enrolls, or that when we do the renewal, right, November, and that period of time that someone can come back and change their plan if they would desire to do so?
Sure, yeah. So initially in the renewal process, we inform people about going into the same plan again, but they have an opportunity then to change the plan if they don't want to be enrolled into that plan. And so in this process as well, we would say not that we're enrolling them back into the same plan, but that we are enrolling them into a higher value plan, you know, with hopefully no downsides, and then they'd be able to either you know, stay with that selection or change their plan as they would under the regular re-enrollment process.
Any questions for Becca? So I move to approve the re-enrollment regulations as presented. Second,
Second.
and all in favor?
Aye.
Aye.
So is Laura Crandon not on the phone anymore? She was on for a little while.
No,
Oh, there
it's
you go.
nay for me.
And if board members can keep your video cameras on, please, so we can make sure we're getting your vote. That'd be helpful, thank you. Laura, you were an A.
That is correct.
Okay, so motion carries. So last but not least, 32 waiver amendment submission, 1332 waiver amendment submission.
Yes, this is my final item for you all today. As you may be aware, in this most recent Maryland legislative session, the General Assembly passed the Access to Care Act, which directed MHBE to apply to amend our existing 1332 waiver, which would allow all residents to enroll on exchange regardless of their immigration status. So that's a waiver of Section 1312 F3 of the Affordable Care Act. And as you know, our existing 1332 waiver facilitates our state reinsurance program, and the waiver period runs through 2028. So for this request, the request is to waive this section 1312 F3 of the ACA for the remainder of the existing waiver period. And then we anticipate that we would launch this new program, the new eligibility rules, by November 1st, 2025 for the start of open enrollment for 2026 plans. Next slide, please. So we have sufficient authority to do this under state law. The first authorizing legislation would be the bill that allowed us to, or directed us to establish our reinsurance program by submitting an application for our original 1332 waiver. And then the second is this Access to Care Act that I've already discussed. Next slide, please. A key part of our application for the waiver amendment request is an analysis showing that we meet the 1332 guardrails, which are comprehensiveness, affordability, coverage, and federal deficit. So we have to show, and we do in our analysis, that we're providing coverage that's at least as comprehensive as what we would provide without the waiver, or in this case, the amendment. And we do indeed show that. We're not requesting any changes to the essential health benefits package. So we meet that comprehensiveness requirement. In terms of affordability, we must show that we provide coverage and cost sharing protections against out-of-pocket spending that are at least as affordable without the waiver or waiver amendment. And we do indeed show that. This would not change out-of-pocket costs or premiums. We also must show that under the waiver, we provide coverage to a comparable number of individuals as without the waiver, and we do indeed show that. It would not impact the coverage of individuals who were already eligible before the amendment, and because we'd be adding eligible people to the pool, it would be actually increasing coverage. And then we show that there's no increase to the federal deficit. And actually our actuarial analysis shows that that premiums will immaterially be reduced by this addition, and it would, so that actually reduces the federal PTC liability and the federal deficit. However, we are not requesting pass-through funding through this waiver amendment. Next slide, please. So we held a public notice, public comment period that ended on the 9th. We held 2 public hearings on this issue. You can find all of that on our website, and then the summaries of the presentations and the meeting minutes and all the oral comments we received are a part of the application package. Next slide, please. So as a summary of the comments we received, all of them were in support of the amendment request, which is great. And so the final application will include all of the written comments and, as I mentioned, the oral comments as well, transcribed as part of the meeting minutes from the public hearings. So if anyone's interested in the commenting organizations, they're on this slide here. Next slide, please. So in terms of timeline, our plan is to have the board here vote on whether or not we should submit the application. And then staff will submit the application to the federal departments. Then the federal government will have 45 days to respond, determining whether or not our application is complete. And then they'll hold their own public comment period. Then after that, they will take 180 days from the day they determine our application is complete to give us a final determination on whether or not they'll approve our amendment request. So that date falls at the end of February of 2025, but we have requested that they give us a determination by the end of this calendar year. And then provided that they approve our request, our IT team will be designing and finalizing system updates and complete their testing through March through August of 2025. And then in November 2025, for open enrollment for 2026, we will have new eligibility rules in place. And all qualified residents, regardless of immigration status, will be eligible to enroll for 2026 plans. I believe that may be all I have. Yep, so I'm happy to take any questions on this.
But before I go to questions, I just want to repeat something that was shared in each of the hearings and just for documentation of our meeting minutes. To be clear, this just gives people access to the current insurance products we have on the market today without going payer by payer to figure it out. It allows them to compare and contrast. They do get some support from the navigators, but there are no incentives, subsidies, or anything like that for people in this expansion population that would have access to the exchange, correct?
That's correct.
Now I'll ask if any questions are open to Becca. Zing, go ahead.
So the comment earlier made was that it will not increase the cost, but it may actually help reduce it because we have more, I guess, participants in the program. I wasn't clear about that. What did that exactly mean?
Well, let me not speak for you and answer the question. I'll let you answer the question.
Sure. Well, there's research showing that that the immigrant population that we would be allowing to enroll are healthier on average than the general population and than the population that's already enrolled on exchange. And they're also on average a little bit younger than our current enrollees. So those factors combined make the pool healthier overall and bring down costs slightly.
So if I may continue, so if that population is taking advantage of the vehicle that we are providing for them to get insured, wouldn't they have their own premium rating, or will that reduce everyone else's premiums too?
It should bring overall premiums down immaterially. So by a very small amount for everyone.
And there's no federal subsidy needed. Will this require any state subsidy of any kind?
No state subsidy of any kind.
Okay, thank you.
Any other questions for Becca? So I move to approve submission of the 1332 waiver amendment application as presented to the Centers for Medicare and Medicaid Services in the Department of Health and Human Services and the Department of the Treasury for an amendment of Maryland's existing 1332 waiver. Can I get a second?
Second.
You all in favor?
Aye.
Aye.
Bye.
Is that everyone? That's okay. Thank you. Motion carries. Carries. Thank you, Becca.
Thank you.
Okay, next we're gonna move on to Tracy Gamble and Venkat to talk about several procurement actions.
Good afternoon. So the agenda that we have prepared for the board today are four different actual IFBs. Informatica Power Center license subscription, MongoDB license subscription, Red Hat software license subscription, and ED Postgres software. I'm gonna allow Venkat to do the introduction and then I'll do the procurement piece.
Thank you, Tracy. Good afternoon, Secretary and members of the board. Sorry, I'm not able to be there present on site. Was got sick with COVID and trying to recover from there right now. So these four procurements that Tracy noted here had been originally procured by MD Think on behalf of MHBE. The reason for that is these are some of the core software on MD Think's platform, even though they were not being utilized by MD Think other entities. So recently, very recently, we had been asked to take on this responsibility, even though that was our direction eventually post our updated MOU. And starting next year, we were going to procure these software, but this was came to us unfortunately at the last minute, but we took it thanks to our procurement team. So the first software is the Informatica Power Center. That's what we call in technology terms ETL, extract, transform, and load. This is the software that connects the database and our application in terms of translating data for the applications to use and during the development also. And the MongoDB is our content management software. This is where we store all our notices, all consumer documents, more than 55 million of documents since the exchange inception. And EDB Postgres is our core database, and that's where all of our data, consumer data, our data, plans, everything is stored in these databases. And Red Hat is a software based on Java. Our exchange is based on Java application, and we develop and our application and interface develop for all interfaces utilizing Red Hat Java. So these are the four core software, and we have listed some advantages and disadvantages in terms of procuring these software directly. In terms of pros, the procurement process for the exchange is much more streamlined, and we can very tightly comply with MHBE procurement processes. And in terms of the timeline, unfortunately, the current procurement that MD Think process that MD Think utilizes, it takes more than 6 to 9 months to procure a software, even for 1 year license. That's a terrible waste of time, and also repeating the same thing over and over every year is an unfortunate waste of government resources. But thankfully, we are taking it over. So our procurement speed is between 2 to 3 months, depending on the complexity of the product and the availability of the vendors. And so far, all along, these software have not been visible to the board in terms of the cost, because we have a monthly payment that we make to MD Think for all these software. And so that cost or financial responsibility is not visible to the board until now. So, and we hope more transparency and visibility to the board, and also to our certain software resellers who frequently talk to us in terms of asking about our platform and what they can contribute in terms of bidding for our services, etc. And in terms of the cons, obviously the additional workload for our procurement team and IT team is higher, and we are trying to reduce a little bit by procuring once in 2 years for any established software, so that at least we can reduce the cycle a little bit. With this, I'll stop that for any questions before handing it over to Tracy. All right, Tracy, please take it away.
Next slide. I'm sorry, was there a question?
I had a question. Venkat, you mentioned that it was, thrown upon us on the last minute. When did we first become aware of it? Because I think this process started in May or something. So May is like 3 months ago.
Yeah, so May 20th is when we were notified. Actually, we were notified on a Friday, and then we had a follow-up meeting on Monday with the leadership team, and that's when we were noted. And it took some time, Mr. Singh, for a couple of weeks to transfer certain licenses, because those licenses were on MD Think's name, and so we had to work with the manufacturers. And there were some instances where gap in licensing period too, because there was, I think Tracy can talk about that. So we had to work with the manufacturers and on that as well. Tracy, would you be able to talk about the gap in licenses in some cases that we found?
Yeah.
There was a gap with Red Hat where we had the actual one bridge to actually provide coverage until we could actually get board approval for the annual subscription today. That was the only one that I actually did a bridge for any of the items that we're presenting today, which was Red Hat.
When you say bridge, you mean?
A 1 month contract.
Okay, so an extension.
Yes.
Okay, and then it was prorated for the month that you were paying for under the prior terms?
No, the manufacturer actually provided us a manufacturer's quote for actual 1 month.
1 month.
And then we actually did a small procurement where we obtained bids and awarded to the lowest bidder.
Okay.
So it wasn't an extension of MD Think's existing contract. It's something that we actually did in-house to actually provide us with coverage. Because the manufacturer or specific software wouldn't actually change their actual start dates, if that makes sense.
It does make sense, but I didn't know you could do that in procurement, so you can do that outside of BPW?
Yes,
Okay.
because it's under $50,000.
Got it. Okay.
Your BPW.
So,
Your
so another,
BPW.
Oh, we're BPW here, okay. We are the BPW. Well, I want that for my agency.
so my other question was,
It's plain, Don Schaefer.
Go ahead, Singh.
can MD Think make this decision? Or we are all part of the same government. Can they make a decision and bump us out like that on their own?
So I can probably note in terms of timeline, Mr. Singh. So these software are already past license period, which is we would never ever do at the exchange. We would very proactively do these things several months back. So we discovered some of those during our repeated calls and finally asked a lot more detail. It looks like on the MD Think part also, they had to go through multiple approvals, first within MD Think, then DHS and Department of Information Technology, prior to even going through IFB route. So it looks like a larger process. To your question specifically, we had been working with MD Think to agree to procure some of the software directly post our new MOU with MD Think. And during our discussion also, it was stated that the first year or the year during which the MOU is in progress, MD Think will continue to procure this software. Unfortunately, those didn't happen. And we were left with the choice of continuing with the existing process, which is already past due, and endure another 3-4 months of delay, or take it over and right now rather than starting with the next year. So we just took the second approach.
And something like this one under normal circumstances, would it go through the exchanges of Audit and Finance Committee?
So for the MD Think cost has one monthly cost that we, when MD Think invoices, we pay for software and non-software expenses. So so far it was never gone through this process. So hereafter it's going to be more visible to the board as we are going to seek approval to the board and send all the details ahead of time.
Right, but this is not the past, but the future, which is what we are trying to do today. If we have been aware, at least since last 90 days, I'm not aware if this was ever mentioned to or discussed at the Finance Committee, and I'll ask the other members of the Audit Finance Committee if they were aware of this or had an opportunity to give any feedback. Please say so. So I'm just trying to understand the process so that we also meet our obligations as members of the Audit and Finance Committee and make sure that we give that feedback to the entire board.
Remember, Tanisha, if I might add, there is, the board has its own procurement policy and procedure, and that is posted online, and we share a copy with that with the board every time it's updated. But the procurements come to the board as a whole. the board has the authority as a whole to review procurements and make decisions on procurements. We added a provision in the board policy, and procurement policy to allow the finance and audit committee to look at and approve requests for resumes and those for IDIQ because of timing issues. So that's the only anomaly, and that is when we're not gonna have a board meeting, but we need to hire a resource, and we need that to get approved. So we wrote into that policy and procedure several years ago that the staff could take that to the board finance and audit committee for approval, but then we again would have to present that to the full board. So all procurements come before the full board.
Okay,
I have a question, and maybe you're gonna get to this, but we're talking here about money. We haven't really got to the details of the money yet, but where is this money coming from? Or, and I'm thinking maybe we already gave it to Maryland Think people because I don't know, where is this money coming from to pay for all of this? Out of clear blue, we have to pay for all of this, so.
Yeah, this software is currently we are paying MD thing. Instead of that, we will be paying the resellers who supply this software. So this is just a transfer of cost. There won't be any change in. It's already approved in the budget for IT software.
Thank you.
It's just, and it makes sense. And, years ago, MD Think wanted to procure it on our behalf, but it's really software that we use. And now in kind of streamlining their operations, they're saying, we don't need to procure this on your behalf. You can procure it, same cost, because it was a pass through, we would pay for it. But now it just gives ownership to procure it back in our court, which makes it easier for us because we can track it, streamline it, bring it, it's more transparent because we can bring it to the board.
That's the clearest thing I've heard so far about all this, because before it was very confusing. It was bouncing off the walls, and thank you.
Any other questions? Let's make on Informatica. So I move to approve a contract award to Informatica in the amount of $210,263.79 per year for a total cost of $210,263.79. Wait,
This is something
Wait,
different.
wait.
I was gonna say, this says Carousel.
so
I was unclear. It's
So that's-
Carousel.
that says Carousel.
Go
I
back.
thought we were on Informatica on the 210 that you had on the previous slide, which was 1 year. This
That's
one,
where we-
For 1 year.
no, go back. Back? Did I read it wrong? Okay, so I read it wrong. I thought we were talking.
Well, hold on though, I agree.
So let me explain. It started out where we were gonna present for 2 years. By the bid closing today at noon, we only received 1 bid, which was from Carasoft. Carasoft only provided us a quote for 1 year instead of 2 years. So that's why it was changed.
So do we have 2 motions in there?
No, we have 1 motion. Should be.
Then go to the next slide.
Well, that's the confusing. part.
Carasoft is the reseller for Informatica.
Oh,
Right, that's correct.
I think there was one
Oh,
earlier.
to procure Informatica
Yeah.
Power Center.
Yeah.
Okay, so this is the one. Okay, so I move to approve a contract award to Carasoft Technology Corporation in the amount of $210,263.79 with a federal participation of $138,774.10 and a state participation of $71,489.69 to procure Informatica Power Center maintenance renewal licenses for the period from August 1st, 2024 to July 31st, 2025 as presented. Can I get a second?
Second.
And all in favor?
Aye.
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 Aika and Laura, have you raised your hand?
Opposed.
I'm
Okay, so-
abstaining.
So
No, we don't have-
No,
we don't have quorum.
no, we do.
we need 5 affirmative votes to pass a motion. So let's do roll call. Cynthia, can you call roll call?
Laura Crandon,
Nay.
Singh,
Yes.
Aika,
Abstaining.
and I don't know if Joy's still here.
Joy could
Oh,
only hear
yeah,
half.
so that's 4.
Okay, so Aika and Laura, can I put you guys on the spot and
But we
ask?
have-
I know, but that's only
Wait,
1, 2,
2,
3,
3, 4. We still don't have
Right,
quorum.
we need 5
Oh, wait,
affirmative
with Singh, is
votes.
that 5?
Singh is-
1, 2, 3,
Oh,
4.
okay,
with
Singh. Can I ask you why you're abstaining or opposed? Or what information do you need or you're not comfortable with? I want to just go deeper on the abstaining and the opposed based on the information provided.
Yes, I'm looking at the policy. I don't know whether this is an emergency policy request. I don't know how this fits into the budget that we already approved for the year with the IDIQ. I
Yeah, because the idea.
literally just got this over the weekend.
Okay, so let me
don't-
address.
I have a lot of
this.
questions and I just don't I don't even know where to start to ask. And
Let me see if I can
that's where I
answer some
am.
of your questions and be happy to address any questions, but for the board to know, we are a small board and our bylaws state that we have to have 5 affirmative votes to pass anything. And this, as you can see, is something that if we don't pass it, obviously, we're gonna be without this technology. Unless we continue to do a month by month, I suppose we could do that. But regardless, it does not have anything to do with indefinite delivery, indefinite quantity. That's only for resources. This is a software procurement. It has already been factored into the fiscal year 25 budget, already accounted for. The only changes before it was a pass-through funding amount that we would get a bill from MD Think monthly or quarterly, and we would get a bill that would come to us and we would pay that bill. The board would never see it because it was a bill that through an MOU we paid. The approval for this contract was done through, I believe, Department of Human Services, because MD Think is under Department of Human Services, but it could have been, was it?
No,
DHS?
it was
Okay. DHS, who takes it to the Board of Public Works. Because the MHBE Board of Trustees is the Board of Public Works for the agency, we bring all, anything that's over 200,000, we bring to the board to approve. We send out a response to Board Member Tanasia's request to make sure everything is sent out a full week ahead of time before the board meeting, so that you have time to read all the memos, and staff prepare very in-depth memos. We send you the board deck, everything to try and answer your questions. And with the intention of, if you have any additional questions, we can certainly get you more information to answer those. So this is not a new budget item. It's not a new software. It's a continuation of software we've been using. The only difference is that instead of it being procured on our behalf and we sending the monies to DHS to pay for it, we are now going to procure it and we will pay the bill directly to Curaçao. So that's the only difference. And I'm happy, Board Member Crandon, if you have specific questions to answer anything more.
And to add to what Michelle just said, this was not done as an emergency. This was done as an invitation for bid, and it was actually put out on May the 20th of this year. Unfortunately, due to issues between, not May 20th, I'm sorry, June 14th of this year. And unfortunately, due to issues with Informatica and IT in my office with lack of communication on the manufacturer's part, that was delayed in actually getting it published as late as June 14th. The bid closed today, so therefore the memo.
You just opened it.
Yes, ma'am,
Okay,
at 12 noon.
okay.
So that's the
That's
reason
why you
why,
have one.
so that's the reason why you don't have the memo that would typically accompany.
So does that answer your question, Laura?
Two things, does that make, because I have July 11th is when I got this, July. It's either July 8th or July 11th. And second, with the closing today and only one respondent, does that make it a sole source?
No.
Makes it a single bid.
I'm
Not
just
a
trying to
sole
go back and
source.
reconcile our policy, just to make sure that we're following the policy.
It was competitive.
So Sharon, can you weigh in that we're following our policy?
Yes, we are following the policy. I don't know if there are any specific questions from member Crandon, but it was a competitive bid and there was one respondent. That doesn't make it a sole source because it was competitive. Sole sources are not competitive bid.
Okay, and you're saying I got this back in, I'm looking back in July 8th. I just want to make sure I'm understanding these dates right.
And Laura, this is going to apply to all the procurement actions that we're talking about today. So not
Oh,
just.
I know,
Okay.
that's what makes them material, is that if you add them all up.
Well, it's, the process is the same. It makes it material if your decision's the same and we can't reach consensus because then they don't have access to the software that they need to do what they need to do. And I'm not saying that we want to undermine the process, but that's why it's important to answer your questions. And Aika, your questions as well, since you abstained. So it would be helpful to understand why you're abstaining so we can try and address your concerns as well. So it was pass-through money. The software was purchased by MD Think, and now they're not passing through the money. They're purchasing the software directly themselves. Saying 1 second, I see your hand up, but it's really important that we understand from Aika and Laura what their questions are.
We're trying to figure out what category this fits in based on where we are. And then the amounts that they're exactly the same, and then where it fits into our policies process. Those are the questions that I have, are in what category this fits in. And then when you say it's a pass-through, it's exactly the same dollar amount. There's no savings and there's no markup. It's literally exactly the same dollar amount.
So Venkat, can you answer that question regarding the budget?
Sure, Secretary. The board member Candon, the cost of the software is, as you noted correctly, it is exactly the same. The reason for that is this is not a cost that is a subsidized cost or some software on MD Think platform, because this is a software solely utilized by MHBE only at this time. So that's the reason why the cost, barring any annual increases, a few percentages, there is no change. And this is also not like a Salesforce, for example, or AWS on use basis you charge. It is not like that. This is a fixed cost for the whole year for specific number of subscriptions. So that's on the cost side. On the budget side, there is no increase to IT budget. This comes under the IT software category. Within IT software, we have two branches. One is MHBE software. The other is software residing on MD Think. So the total IT budget is exactly the same. There is no change in it. Instead of paying MD Think upon invoiced by MD Think, we will be paying the exact cost to this reseller who would supply the software for us. So and there is no budget increase. It's exactly the same budget also.
And to answer,
Right, I was
gonna
gonna
say,
say,
to
how
answer
you're saying.
the first question, yeah, it's a competitive sealed bidding. Is that what you're asking for in the procurement policies?
It was a competitive bid that didn't yield competitive pricing.
That's not necessarily accurate. The process is called competitive sealed bidding. So it's competitive because you don't know what the cost is, what the price is, or what the bid will be until it's opened. And that was done today.
Correct.
And in the procurement policy, it's under number 2, methods of procurement B, competitive sealed proposals, and that will go through the process. And it's not, there are times where we only get 1 or 2 bidders. That's not unusual for that to
It's
occur,
not.
correct, Tracy?
That's correct. And unfortunately, I mean, this was the only one out of the 4 that we're presenting where we only received one response. With all the other 3, we have competitive actual responses. So.
Just 1 second, I might get to Singh before we get to you, if that's okay. Singh, go ahead.
Yeah, so I have 2 questions. One is CareSoft the current vendor also with MD Think for this, or was that a different vendor?
To my knowledge, they are the same vendor.
Okay, good. So that's one. The second was, as you mentioned, Venkat, that these are pass-throughs, which is the comment I relied upon, part of, my supporting it. But can we get a worksheet that shows for these 4 softwares, what the amount we are paying to MD Think, and what the new amount you're getting here for approval? Because if they are comparable, then yeah, we had it in the past, we will have it in the future. It was a pass-through before, now we're paying directly, but no change in the cost, which is what you're saying, but a worksheet will be helpful to show.
Mr. Singh, what we can do definitely is, like you said, for the last 12 months, the cost that we pay for these software, because we pay MD Think on a monthly basis. So MD Think acquires these software at various times and then charges us per month based on the total cost. Definitely, we would be able to send you that detail.
So I think that will be helpful.
And
Okay,
I'm
but
just
Singh,
looking, I'm trying to reconcile the budget, and these look like 2 items. I just want to make sure where there was overage. So I'm just, when you say it's in the budget, I just want to make sure I'm tracking to that. Over under for the fiscal year 24. Year-to-date balance state.
go ahead, come to the table.
Yeah, hi, this is Tony Armiger. This is FY 25 software, so this is not.
Okay, I'm going on the documents that were sent to me on.
Right. So where that is in the document
Okay,
that you
good.
sent in MD Think software, that's where this is for FY 24. It's in the line down in IT. There's about 7 lines in IT, and it's the second from the bottom line detail. It says MD Think software. That's for FY 24. That's last year. For FY 25, it will be 2 lines up in software. If that makes sense.
But not.
Right.
Okay,
In 25, it will not be.
Madam Secretary, those are where my questions lie. I just.
So
trying to
based
make
on
sure.
what I'm hearing Tony say, they're accounted for in the 24 budget and the 25 budget. Venkat and we've heard it's the same amount. And we've already made the distinction between sole source and single bid. So does that answer all your questions, or do you still have outstanding questions?
I just wanted to make sure, because we made some adjustments to from last year. Hold on 1 second. Trying to make sure I have all my questions answered, because I don't see the document that Tony referenced in my July.
It's in the board financials. The board financial statements.
Yeah.
You can look at it's the first page of the board financials is summary. The second page has the state, and down in the state it has a detail for the IT costs. So the first category starts out as maintenance, and then enhancements, then system support, shop, software, and hardware. MD Think MD Think, I think it's MD Think and then MD Think software.
And Aika, while she's looking, can we answer your questions regarding your decision to abstain?
My questions have been answered in this discussion, so thank you for coming to ask, but I am good and I am happy to vote.
Or should I make the motion again, just so we're all clear? Okay, so I move to approve a contract award to Carasoft Technology Corporation in the amount of $210,263.79 with a federal participation of $138,774.10 and a state participation of $71,489.69 to procure informatic power center maintenance renewal licenses for the period from August 1st, 2024 through July 31st, 2025. Can I get a second?
Second.
Ben, all in favor? Aye.
Aye.
Any questions? I'm gonna get to opposed. I'm just making sure there's questions before I get to opposed. Aren't I supposed to go to questions before I go to opposed? Okay, so any opposed?
Yes, I still oppose. It's Laura.
Okay, we have quorum, so motion carries. Slide.
So the next software that we're asking for board approval on is MongoDB. And Venkat has already given explanation as to what the exchange actually used it for. This was done as an invitation for bid as a subscription renewal for a license period of July 19th, 2024 to July 18th, 2026. Cost of license year one is $196,288. For year two, the vendor proposed a different cost of $206,618.94. The vendor that we're recommending for award is Carasoft Technology Corporation. And the total amount for this particular contract that we're asking the board to approve is $402,906.94. Cynthia, if you go to the next slide.
So I have a question on this one. Why are they asking for $10,000 more in year two?
Well, they have that right. I don't know why they're actually doing that, but they have that right on the actual bid form to actually change their price if that's their choice when they actually submit the bid.
Okay, and
when
say, how many bids did you have on this one?
Next page. I have 10.
And they were still the lowest one?
Yes, ma'am. As a matter of fact, yes, the prices range from $402,906 to $501,858. The IFB was issued on June 5th, 2024, and it actually closed on July the 10th. We received 10 responsive bids. We received 10 bids, 8 of which were responsive, 2 of which were not. And we're actually recommending Carasoft Technology Corporation for award.
Any questions for Tracy? Okay.
Thank you.
So if you're saying July 10th, it closed. I'm just trying to reconcile that with giving us a week to review. Maybe I missed it.
Yes, it closed on July 10th.
That's correct.
Go ahead, Ben.
Thank you for your clear presentation in the preceding one, as well as this. Just the differences between the 8 bids that were accepted. Basically, MongoDB is giving everyone a price.
Right.
MongoDB does not sell directly to end users.
Right.
They do it through agents, if you will, resellers. And the different MongoDB, the price is the same. What the resellers are going to add on as their fee differs. And, I applaud you for selecting the lowest bids.
Thank you.
Any other questions? Singh, I think you had your hand up.
I do. The question, that was in the previous discussion, when Anthony, you mentioned, Tony, that the budget for the software under MD Think, that was for the annual $644,000. And I know that was for fiscal 24. So by the time we approve all of these, I'm looking for a number that will be comparable to that 644. Is that the right assumption I'm making here?
Yes, sir. So what should happen is the amount that we're increasing these four softwares next year, MD Think software should be decreased by on a monthly basis. So if you take these four softwares, and actually I believe there might be these four softwares divided by 12, MD Think software should be decreased by that amount in the financial statements.
So between these first two softwares, we are almost close to $600,000, the one we approved before and this one. Somewhere between 550 to 600. So that means the remaining are below 100,000, the remaining that we have to approve, right?
So the second one was for 2 years. So it's basically 200,000 per year. So it's $400,000 spread over 12 months for these two. It's actually 196 for the first year for
I see.
This one, and then the other one was 210.
So it's spread over 24 months, not 12 months.
Okay. So, okay, so that's fine still. So by the time we compare all four, will be equal to about, give or take, that 644.
Right. So, yeah, the 644 will be spread, the 400 for this year will be spread over 24 months.
I'm on an annual basis, I was saying on an annual basis, they should equal about 644.
No,
400.
yeah,
Because the first one's for 12 months, Informatica's for 12 months.
And how much was that?
And then the second one is over 24
that one
months.
was $210,263.79.
The first one,
The first one,
and that's for 12 months.
12 months.
And how much is the second one for 12 months?
Well, the second one is $196,288 for year one for the
Right?
first 12 months, and then $206,618.94 for year two.
So it's more than doubles in the year two, we're saying.
No, it's not more than, no, it's I'm sorry, I read the wrong number. It's 206,000, that's what I said, 206,000. So it's $10,000. It's about $10,400.
Okay. I'm sorry. So this one is 109. So let's just look at the first 12 months for all
So
of
it's on the slide, Venkat, I'm sorry, Singh. It's on the slide right in front of you,
Right, so it's 196 for this one.
Yes.
And how much was the first one we approved a few minutes ago?
$210,000,
Exactly.
$263.
Okay, so 210 plus 196 is $406,000 that we have approved so far. And we haven't approved, I'm sorry, the second one that we have been presented so far, 406,000. So if I compare with 644, the remaining will be about, give or take, another $240,000. That's all we are saying.
Right. I'm sorry, I didn't catch.
So are you saying the 644, that what they have in the 2024 software budget is 640? Where is that number coming from?
That's in Tony's financial statement into the annual budget projected.
And that's for everything?
Yeah, that's
So-
on the empty think line that you were, when Laura asked the question,
Right, but
about the financial.
Remember, that's the total award of the contract, or is this M&O or DDI? So what's the match
This
on
is
that?
actually FY24 numbers.
Okay, but your numbers reflect the state general fund portion of it, right? Not the federal drawdown.
Well,
It
there's
does
the
include the
federal-
federal drawdown.
It does.
Okay.
And
Yeah.
You'll see where it's split later. Right. in
Right,
there.
but I know I see what it says here. I'm trying to reconcile the numbers to what Singh is reporting. So does your budget numbers include the federal drawdown total, or is it just the state general fund match?
There's a page for each. There's one page for state match. There's one page.
So Singh, can you look at the page for state match and the page for federal match to get the total award?
Okay,
Total.
so
Madam Secretary, if I can quickly say
please.
that the MD Think software licenses total budget is not 600,000, it's $2 million. I think probably, Mr. Singh, the number that you are referring to is the state portion of it, because the federal
That's why
portion
I'm
is
asking for the
1.336 million.
distinction.
Yeah.
Sure. So the federal, no, you're right, and that's what we are trying to understand. So 644 was one, and 1206 is the other one. So between those two is 1,850,000, 1.25 million dollars. 1.85 million, I'm sorry.
That's right.
85.
And in FY 25, that approved software licenses under MD Think budget was 2.025 million.
Okay, so that's what and these four that we are discussing today represent 100% of the licenses we were paying MD Think for, right? There's nothing outside of these, right?
Nope, that's what's on the agenda. So can I make a motion on the next one? Is everyone ready for a motion or are there more questions?
So the last comment I have is though, so whenever we get a chance, Tony or Venkat, please send us that comparison worksheet. That's all.
Sure, Mr. Singh, will do.
So I move to approve a contract award to Carasoft Technology Corporation in the amount of $196,288 for year one and $206,618.94 for a total cost of $402,906.94 for 2 years, with a federal participation of $265,918.58 and a state participation of $136,988.36 to procure MongoDB subscription licenses for a period from July 19, 2024 through July 18, 2026. Can I get a second? Dana, thank you. All in favor?
Aye.
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 Aye. Any questions? No, I'm going to oppose. I know you guys want me to just jump. I'll skip questions then. We'll just assume they're all answered. Opposed? Laura?
I just can't get to the number with the overage, so that's it's my issue. I can't get to where you are in the fiscal year 25 and understanding fiscal year 24 where it was an overage. I can't get to the number, reconcile that. It's my
Okay,
problem,
so you're opposed?
yes.
Okay, so we have quorum, motion carries. Next.
Okay, so the third software is Red Hat. We actually did an invitation for bid for Red Hat as well that we actually published on June 10th of this year. The license period covered will be July 29th, 2024 to July 28th, 2026. The cost for year one is $104,660.16. We're recommending Optimize Inc. as the vendor for award, and the total cost for the 2 years would be $209,320.32. Next.
Basic charging, same thing.
Yes.
For the 2 years. Okay.
Next
Next
slide.
one.
As I stated, we issued the IFB on June 10th. It closed on July 11th. We received a total number of 21 bids, 16 of which were responsive, and the lowest bidder is Optimize Inc.
Any questions on this one?
I just have an overall question, and again, I'm making an assumption, but I want to hear you guys answer it. I hear you saying that you're choosing the lowest bid.
Yes, ma'am.
What about qualifications?
They're buying the software.
We're buying software.
I'm sorry, that was.
And as long as they actually, as long as they're actually registered with SDAT, and that's all we basically do. That's okay.
I'm going to the details.
No. I mean, that's what. Any questions on this one? Any more questions? Okay, I'm gonna make a motion. I move to approve awarding a contract to Optimize, what is it? Optimize in the amount of $104,660.16 per year for a total cost of $209,320.32 for 2 years, with a federal participation of $138,151 and 41 cents and a state participation of $71,168.91 to procure Red Hat subscription licenses for the period from July 29, 2024 through July 28, 2026. Can I get a second? Yep. All in favor?
Aye.
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 Okay, so this one's unanimous.
And the last one. Last one is ED Postgres. We actually issued the IFD on April the 3rd. But during the course of the actual bid process, I had to issue 2 amendments, which actually extended the actual closing date. So that's the reason why there's going to be a big gap between April 3rd and the date that it actually closed. But the proposed license period is August 28th, 2024 to August 27th, 2025. This is a subscription renewal. Total cost is $263,747.90. The recommended vendor for award is Zones LLC. Cynthia. As I stated, this was issued on April the 3rd, but during the course of the bid, as I stated, I had to issue 2 different amendments, which actually caused me to have to extend the bid due date out to June 17th. And once the bid closed, we received 8 bids, 7 of which were responsive, and we're recommending Zones LLC as the recommended vendor for award. Any questions?
Any questions on this one? Okay. I move to approve awarding a contract to Zones LLC in the amount of $263,747.90 for 12 months with a federal participation of $174,073.61 and a state participation of $89,674.29 to procure EDB Postgres subscription licenses for the period of August 28th, 2024 through August 27th, 2024. Can I get a second?
Second.
All in favor?
Aye.
Aye.
Opposed? Oh, Laura, you in favor or opposed?
In favor.
Okay, motion carries. Cynthia, could you do me a favor and just go back to motion 8, the Informatica? What was the state match, Tracy, on that?
The state,
Slide 6.
Go back.
Yep.
go forward. Forward. One more. Right there. The state
Match was 71,489.
69.
All right, thank you all. Thank you, Tracy. Thank you, Venkat.
Thank you,
So
Madam Secretary.
next we'll hear from Tishma on the annual financial report.
I think,
Oh, sorry,
Tony's gonna
Tony,
do it.
sorry. I'm reading off instead of
Yeah.
looking up. Okay, thank you.
I have this, have my, PowerPoint? That's fine. This is for your stuff. Copy this.
I said, can we wait for secretary to get back or you want?
You can keep going.
Okay, so basically what I sent out is I sent out three sets of financial statements to the board. One of the financial statements was, which had the narrative attached to it, was the actuals through May 25th. So that's only through July through May.
Tony,
Yes, sir.
can you enlarge it, please? I can hardly see
I
it.
think I can. I don't know how large they're on here.
Let me see if I can get on.
There's a down below, there's a plus. See that
Oh, I
plus?
got it. I just saw that. Hold on. Yeah. Better?
Going as big as you can.
Yes, a lot better. Thank you.
So basically this is January, July through May. So this is 11 months actual. Also sent was a page of the comparison between FY 24 and 23. And then the next one, which I'm going to go over, this is June projected. So basically in this, this is the so if you go back to the this is the first page. What I was talking before, it was the first page is a summary. So the first grouping is the state or the state actuals versus the state budget. The second grouping in the middle of the page is the federal portion of our expenditures. So that's, and you see to the right, that's the total. Actually, it's the first 11 months total actual plus 1 month projected. And then the bottom grouping is the combination of the two.
Tony, can I ask you, because there's people on this call calling in that may not be really in the weeds of finances. For the annual report, can you just kind of give a high level of where we are as an agency for this fiscal year 24?
Right.
Close in the red or the black?
Well, we're gonna close, actually, we're gonna close in the black. The projected.
It's good, given the last meeting and what you talked about.
And so basically why we are closing in the black is because so at one point in time, we were projected to be 1.5 million in the hole. And what happened is the bridge collapsed and basically the word was DBM wasn't giving out any funds, and that was conveyed to us. So we kind of came up with alternative solutions. And one of the alternative solutions was we could get a higher participation rate for fulfillment for printing notices. And that actually for FY 24, it's going to be about $900,000 difference. So to the good. So 1.5 down, 900,000 brings us to 600,000. In addition to that, we did get a budget amendment for payroll items, about 250,000 for state funds. In addition to that, the connector entities were told to slow down or stop their spending. Usually at the end of the year, they'll spend to get some equipment and stuff. And Tamara and Michelle basically said, no, slow down. So that should save about $200,000. And the last thing we did was software. We postponed purchase of some software, which it goes into FY 25. So what we did was the bridge Tracy was talking about before for some of the software. We made a bridge to get us over to FY 25, and then we procured it for a whole year. So with that combination of items, there's also another thing too, with talking with MDH Revenue and Liz, Elizabeth Castlemeyer, we actually can go back and put in for a prior period adjustment. And that's going to be about $550,000. The $550,000 state funds to the good is not included in here because we did submit it. We submitted it about a month ago, and we're waiting on MDH to submit it to CMS. Make sure we get the funding back. But so in addition to this $57,000, there could possibly be an extra $550,000 from the federal fiscal year 23.
And that would revert back to the state general funds because
Yes.
we don't keep any, but it's positive for the state.
Yes.
And I'd also like to acknowledge, because we have David Stewart here today in the audience, who's one of our connector entities, and just our gratitude for working with us when we said we have to tighten the belt. And so appreciate that from our connector entities.
Thank you.
So, yeah, I don't know if you want me to go into detail, but that's where we are. You know, I mean, we need additional federal funds, which DBM will give us. Because we're shifting those funds to 22% from state funds to federal funds. Which makes sense, because if the federal participation rate is higher, then the feds will have to pick up a little more.
And I'll just add kind of overall that, you know, as the agency, we really do look at our finances very tightly, monthly, and really work to make sure that we are very good stewards of the funding that we have. I really want to appreciate, I know Tracy in procurement it just had to do a whole bunch of extra work through the procurements. But really making sure that we are competitive in our bid process, that how we're spending funds internally, we're really always mindful of. So appreciate that everybody in the agency kind of came together to say, how can we make up this shortfall? And just ecstatic that we were able to do that.
Are there questions for Tony?
Sweet.
Cynthia, does anyone have any hands raised? I can't see people anymore. Or anyone in the room? Any questions for Tony? Thank you, Tony.
Thank you. Thank you, everybody.
I want to be mindful, Scott, of your compliance report, and since it's a no vote, I don't want to rush you with 3 minutes left, and I want to be respectful for people's time that they may have another meeting. Can we push this to August, or does that work for everyone?
Question, if I may.
Go ahead.
I don't have any problem pushing it to August. Just a quick question. Is there any in the report any information of urgent nature that the board needs to be aware of? That's the only question I have.
Yes, board member Singh, I can address that. There is no urgent business that I have to discuss or new business. We are still waiting on our Office of Legislative Audits report, so nothing urgent to your question.
Thank you.
Yes, sir.
Okay, so we'll push the annual compliance report to the August meeting. Any last minute questions or comments before I close out the July meeting? Thank you all. With that, I'll adjourn our July 15th meeting. Thank you.
Thank you.